On the front, here's tensor fascia lata, sartorius, and rectus femoris. Psoas major and iliacus, pectineus, adductor brevis, longus and magnus, and gracilis. And here again are piriformis, obturator internus, and obturator externus. Now we'll move on and look at the blood vessels and nerves of the hip region. We'll follow the course of the vessels and nerves from the inside of the body to the proximal part of the thigh. In the next section, we'll follow them on down to below the knee. To understand the course of the main blood vessels, the femoral vessels, there's a structure we need to look at that we saw briefly before, the inguinal ligament. And there's a space between muscles that we need to understand called the femoral triangle. Here's the inguinal ligament. It's a strong, tight band that forms the lowest part of the anterior abdominal wall. The inguinal ligament passes from the anterior superior iliac spine to the pubic tubercle. The inguinal ligament isn't an isolated structure. It's the lower edge of this large sheet of tendon-like material, the external oblique aponeurosis. The inguinal ligament is this part here. The fascia lata, which we've seen already, is attached to it along here. The gap between the inguinal ligament and the superior pubic ramus is occupied partly by the iliacus and psoas muscles, and partly, as we'll see, by the femoral nerve, artery, and vein, and the inguinal lymph nodes. The other muscle in the picture here is obturator externus. Now let's add all the other thigh muscles to the picture and see the femoral triangle. Here the fascia lata has been left intact. Here it's been removed. The femoral triangle is the name given to this deep hollow. It's bounded by sartorius laterally, adductor longus medially, and the inguinal ligament above. In the depths of the triangle, pectineus, psoas major, and iliacus pass backward toward their insertions. Now that we understand the inguinal ligament and the femoral triangle, we can move on and look at the blood vessels of the hip region, starting with a brief look at the principal veins. Almost all the veins in the region run parallel to arteries of the same name, so we don't need to look at them all separately. But there's just one important vein we do need to look at that has no corresponding artery, the long saphenous vein, also called the greater saphenous vein. With the main vein, there's a change of name that we need to understand. Below the inguinal ligament, it's called the femoral vein. Above the inguinal ligament, it's called the external iliac vein. It's the same with the artery. The vessels themselves don't change, just their names. Here's the thigh with just the skin removed. The anterior superior iliac spine is here. Here's the long saphenous vein, which starts at the ankle and passes up the medial side of the knee and up to the top of the thigh. We'll remove all the subcutaneous fat to see it better. The inguinal ligament runs from here to here. Here's the fascia lata. Superficial veins from other parts of the region join the upper end of the long saphenous vein, which passes through an opening in the fascia lata, the saphenous hiatus. Here, near the top of the saphenous vein, are two of the inguinal lymph nodes. The main lymphatic vessels draining the lower extremity pass under the inguinal ligament here. To see where the saphenous vein goes, we'll remove the fascia lata and the underlying fat. Here are the main blood vessels to the leg, the femoral vein and artery, and this is the femoral nerve. The long saphenous vein ends by joining the femoral vein here. The femoral vein passes beneath the inguinal ligament. To see where it goes, we'll remove the abdominal wall, leaving just the inguinal ligament. This is the inguinal ligament. This is the top of the pubis. Here, the vein is called the femoral vein. Here, above the inguinal ligament, it's the external iliac vein. It's all the same vessel. To see where it goes, we'll remove the artery. This muscle is the psoas major. The external iliac vein is joined by the internal iliac vein to form the common iliac vein. The right and left common iliac veins join in the midline to form the inferior vena cava. Now we'll remove all the veins from the picture so that we can look at the arteries. We'll look first at the internal and external iliac arteries. Then we'll look at the femoral and deep femoral arteries, which supply almost all of the lower extremity. Then we'll look at the gluteal arteries, which supply the gluteal or buttock area. Here's the abdominal aorta, dividing to give off the left and right common iliac arteries. The common iliac divides into the internal iliac and external iliac arteries. The external iliac passes under the inguinal ligament, emerging as the femoral artery. The femoral artery gives off two small branches and one large branch. The small branches are the superficial circumflex iliac, which runs laterally,